Let's focus once again on health matters. I want to show you these images. Health workers at the Kenyatta National Hospital downing their tools today to demand for a new salary structure. And whilst this was happening, in the parking lot, a tragic incident occurred. A patient in a vehicle passed on there. Now, this middle-aged man, who was actually transported to the hospital in critical condition, was kept at the parking lot for several hours unattended as health workers downed their tools to demand for that new salary structure. And indeed, it was a day of pain for patients at that hospital as health workers who grounded their services left hundreds of these patients unattended. Let's get more details from Nimrod Tabu.
10 a.m. in the morning, and this red car prepares to zoom off from the Kenyatta National Hospital compound after staying here with a dying patient for close to 2 hours. The man, who was in critical condition, is reported to have died after being unattended to.
Wakati tunachukua kitanda, daktari mwingine akatuona kitanda ni ya nini. Madaktari wamegoma, tukarudisha kitanda. Nikaona jamaa alikuwa amevaa kapudi ya weights. Kafikiria ni daktari. Kwenda kuongea na yeye, tukaongea yetu ya nyumbani. Kamuulizia unaweza tusaidia aje kuhusu mbeste yangu. Kaniambia anaweza kusaidia, but mko too late.
Today marked the beginning of a strike by all health workers at the hospital. At the hospital's corridors, more patients looking desperate and in agony. Doctors, nurses and other health personnel who would otherwise be attending to them were not in the hospital wards or theatres. Instead, they were here at the parking lot adjacent to the accident and emergency area. In song and dance, they denounced the hospital's management as well as the Salary and Remuneration Commission for failing to pay them their salary increment.
Pesa hii ilishatolewa na serikali na ni lazima ilipwe wafanyakazi wa Kenyatta.
SRC has been frustrating public sector workers. You cannot say that you are not going to be involved in negotiations, but on the back end, you're the ones who's giving the prescription on what needs to be paid.
For many patients, this strike has come at a very wrong time. Most of them cannot afford treatment as their businesses or employment was affected by the COVID-19 pandemic. They want the health workers and authorities to find a quick solution.
Daktari alinipatia appointment nikuje leo kutibiwa. Kufika napata maandamano. Na mimi mwenyewe naumia kuziki tu nimewekewa. Ikipita na siku mbili italeta rashes kwa mguu.
The health workers, on the other hand, insist they must be given what is rightfully theirs before they can call off the strike. Last evening, the officials of the health workers and doctors' unions were held in a series of meetings that failed to end the impasse. The health workers want the government to implement a 2012 resolution in which the hospital was recategorized from level 3B to level 7A and consequently improve their salary scale. However, SRC has maintained that the recategorization had nothing to do with the welfare of the health workers. Some patients have now been forced to move from KNH to other hospitals as the strike continues. This evening, the SRC wrote to KNH giving the management the go-ahead to pay the health workers their improved salaries at the end of the month of October. But the health workers are having none of that, insisting that the payment must begin this month. Nimrod Tabu for Citizen TV.